bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Are you spending most of your summer days outdoors? If so, are you checking your kids, your pets, and yourself for ticks? Hello and thanks for joining us. You're watching Comcast Newsmakers and I'm Linda Kurtz. Joining me in the studio this hour is Paula Eggers, and she's an infectious disease epidemiologist for the Delaware Division of Public Health. Today we're talking about Lyme disease. Thanks for joining us today.
Thank you for having me.
So what is Lyme disease?
Lyme disease, an infection caused by the bite of an infected deer tick.
Okay, and is it only the deer tick that transmits the disease?
Yes.
Okay, now we are actually going to hold up some pictures here of the deer tick. Describe what we're seeing here.
This just is a scale that shows you actually the size of deer ticks. It goes from the adult down to the nymph. And the very smallest picture there is obviously the nymph size, and those are the form of the tick that often feed during the spring and the summer months when we see most of our cases of Lyme disease.
Okay.
So they're very small, very hard to detect on your body.
I'm going to go ahead and show the next picture. This is pretty scary.
It is scary, but it's a great picture because it shows the mouth parts of the deer tick, and the center jagged edge there is actually what penetrates the skin.
Okay, now something we really need to look out for here is this ring-like rash. This is one of the symptoms.
That is a classic, what we call a bullseye rash, that occurs in approximately half. There's some controversy. Some people say up to 80% of patients with Lyme disease will develop the rash. Others say much less. So if you're one of the fortunate ones that develop the rash, it makes diagnosis a whole lot easier.
Good. Now this last picture here, here's a picture of the United States. Can you describe to our viewers what this means?
Absolutely. Again, a picture of the United States, but the areas in black are the states that have the highest incidence of Lyme disease. And Delaware is fortunate or unfortunate enough to be in one of the top 10 states for Lyme disease.
Okay. Well, let's talk more about symptoms.
Okay.
What do we need to be looking for?
Well, unfortunately, Lyme disease, unless you're one of the fortunate patients that develops that classic bullseye rash, the other symptoms for Lyme disease can mimic many other things. You know, symptoms can include fever, fatigue, headache, joint pain, muscle pains, which can mimic many other things.
Right. You know, I met a girl recently and she was just living her normal life, and she said she woke up one morning, she had never seen the rash, and she couldn't move. And she had no idea what was wrong with her.
Right.
It can be truly devastating.
And that's often what we hear. So many of the cases are that way. It makes diagnosis very difficult. There are some later symptoms that can occur, you know, such as arthritis in one or more joints. Frequently we see it in the knee. You know, if it goes on that it's undetected and undiagnosed, people can develop problems with their neurological system, facial paralysis, problems with their heart, and so forth.
Right. Well, let's talk about treatment then. What types of treatments are out there?
Well, actually, if Lyme disease is diagnosed early enough, there are several antibiotics that are effective in treating Lyme disease. Some patients, you know, it just depends on their symptoms. Some patients will actually require a second course of therapy, or even a few will require IV antibiotics. But again, if it's diagnosed and treated early, the antibiotics that are available are very effective for treating Lyme disease.
So are you saying that it is curable then?
Absolutely.
Okay, wonderful. Then let's go back to the diagnosis part, because it seems like that's a really difficult process. Describe the process.
Well, again, the symptoms are very vague, and you know, thank goodness we have some astute physicians or healthcare providers out there. There are blood tests that can be used to help guide the physician in the diagnosis. They're not 100% sensitive, but they are available and they can help detect antibodies in the blood, you know, after a patient has been infected.
And most importantly, look out for the ticks, because this can be prevented.
Absolutely. Prevention is the key.
Okay, thank you so much for joining us today.
You're welcome.
This hour's newsmaker has been Paula Eggers. I'm Linda Kurtz for Comcast Newsmakers, seen exclusively on Comcast Cable. Thanks for watching.